I don't know about you. The moment that you remember realizing that this was real, that this COVID-19, this was serious, this was not something just in a country far away, but this is something that is impacting all of us. For me, it was the Johns Hopkins website, the coronavirus response team, and the way that they've been tracking this disease, and watching initially when a friend sent me that website how it was isolated to China, but then realizing that it was spreading quickly. Hope International is a global organization, and anytime there is an issue like this, we pay particular attention knowing that it is going to impact our staff, our family, our friends. I remember as well, we had a prayer meeting early on, and it was the first time that one of our staff members talked about the impact on family. And whenever there's that direct connection, it brings it even closer to home. And so this is real, but also as the disease has spread, the other thing that is true in this particular instance, but it's true whenever there's a crisis, is that it disproportionately impacts the most vulnerable. Now, with the coronavirus, we know that that is true from a health perspective, that the elderly and those with underlying medical conditions are the ones that are at greatest risk. But we also know that there's an economic impact as well. And I was just talking to a friend yesterday about here in Lancaster, Pennsylvania, the impact on individuals that are hourly, individuals that are caring for kids, that now those kids are out of school, impact on savings not being sufficient to weather very many days. And we know that beyond the health crisis, there also is an economic crisis as well. And then fear. I don't know if you can feel it, but it creeps in, and oftentimes it is in the midst of all of these conversations as well. So there's a health issue, and it's very real. There's an economic issue, and it's very real. And there's a fear issue, and it is very, very real. Now, all of these issues are compounded with Hope International because of the places that we operate. The health issues are made more significant because of the underlying health infrastructure and the inability to diagnose and to treat in many of the places where we serve around the world. And even in the last couple days, knowing that there are cases in Rwanda that seem to be growing, that is a very real concern. Knowing that it's not just there, but throughout Asia, throughout Eastern Europe, that these cases are now impacting the places where Hope International serves. And Hope International, we exist to invest in the dreams of families. And we know as we do this, as we try to help individuals share the hope of Jesus and provide a job, the economic tools that they need to work their way out of poverty, we know that the micro-entrepreneurs around the world are already being impacted. I heard about one entrepreneur in Asia that had a restaurant, and the restaurant, not surprisingly, had to close. And just imagine if you for years were trying to save up, or years trying to have a little bit of savings, and now in a moment there is absolutely no cash flow. Imagine the impact. And for many around the world, the question isn't just what happens if I get sick, but the question right now is, where am I going to eat? Consistently, disasters impact those on the margins most acutely. And as followers of Jesus, we don't just think about ourselves. We don't just think about the impact on us and our loved ones, although we are concerned about that. But we're invited to have a bigger world. We're invited to have a bigger heart, more compassion, realizing that what we are weathering, what we are going through individually, that there are individuals around the world that are going through it in a much more significant way. Last night, even talking with my family about this and the impact, I was struck by there really is no precedent within my lifetime to know how to deal with this. I can't look back to my childhood and say, well, this is how we responded. There's no ability to look back. People say 1918 was the last time something like this was impacted. And so we don't have precedent. We don't have the ability to really look back. But I look at two different places right now, and the first place I look is to the global individuals that we serve. Many of them live with a sense of uncertainty. Many of them live with a sense of underlying instability on a regular basis, and I have been so inspired throughout my career spending time with them by the resilience, by the faith, by the courage, by the love, by the way in which all of these things are shifting, and yet their faith is so incredibly strong, and they are a source of inspiration to me right now. And the second place that I look is actually the history books, because chaos and crisis, they're not new in our lifetime. This has always been part of our story. And we can look back into what was going on with the early church as one example of what it looks like to respond well in this particular moment. There's a book called The Rise of Christianity. It was written by Rodney Stark, and in this book he looks at a question. How is it that 11 cowering disciples within just a few hundred years had this spread of Christianity? What is it that made them different? What is it that caused this rapid rise of Christianity? And in that time, there were two significant epidemics, one in 165 AD and the other in 251 AD. And what Rodney Stark realized is as these were devastating the Roman Empire, followers of Jesus modeled a different response. A willingness to sacrifice, a willingness to love, a willingness to open their hands and their hearts, a willingness to respond. And what Rodney Stark wrote in this book, he said, Christian doctrine provided a prescription for action. And that is absolutely true. We know that that's true. When Jesus was asked about the most important law, when Jesus was asked to give the cliff notes of the entire story, what does Jesus summarize with? Love God and love your neighbor. At the very core of our faith is this invitation to say our love for God impacts the way that we respond to others. And throughout history and throughout Scripture, there always is a particular area of focus and attention on the vulnerable. Matthew 25, talking about the sheep and the goats, and Jesus says, truly I tell you, whatever you did for the least of these, my brothers and sisters, you did for me. And that's our invitation. That is our faith, to respond with uncommon love and sacrifice. And with a backdrop of crisis, this is an invitation for us to respond. Bishop Dionysius, again writing in The Rise of Christianity, Rodney Stark tells how this first bishop of Athens said that the Christians were known for their unbounded love and loyalty. They never spared themselves. They thought only of one another. He talks about this expression of faith that was seen most clearly in a moment of crisis. And that's what I hope we are known for as well. There's a book called The Great Opportunity, and it talks about how at this moment in time, there's an invitation to be part of a church that is famous for its radical care for the poor, and in so doing, to point people to Jesus. And that is what I believe the invitation is for all of us as we deal with the health issues, as we deal with the operational issues, as we deal with the economic issues, as we deal with fear, to deal with all of them in a way that people see that we are part of a different kingdom and respond differently in a moment of crisis. And so what that means for hope, we refuse to give in to fear. Fear is not going to be our motivating or driving force when we make decisions. We are not going to give in to fear. In a crisis, fear causes us to go inward, to hold on to what we have. It causes us to play it safe. It causes us to go in, to grab all we can. And yet the invitation that we see in Jesus is exactly the opposite. There is a different and greater mission and mandate, and it is not one that is internal. It is one that is external, of saying, what does it look like to love God and love our neighbors right now? So practically, what does that mean for Hope International? What does it mean for us right now? How do we have this ethic of love guiding the decisions that we're making? So for staff, what that means for our staff is right now we believe loving others means that we adhere to social distancing. That right now, in places where the virus is spreading, it is not loving if we continue to meet together. And so for us, we have a travel ban for staff. Our work continues, but we are shifting to remote. Our office here in Lancaster, Pennsylvania is closed. We are closing our doors here, but we are opening our laptops, and the work is absolutely going to continue. We are moving to virtual operations. It also means that as we adhere to social distancing, we are every bit committed to virtual closeness, and there's going to be a lot of opportunities for us to use the gift of technology to stay connected with our global team, with the operations as decisions continue to be made. There's a security task force, and there are daily conversations happening as decisions unfold. And I am so proud of this team at Hope International as they respond with uncommon love and wisdom in knowing what it looks like to respond. For our operations right now, we operate in 16 countries around the world, and there are a lot of decisions that are country by country. But as you know, if you've been around Hope for a while, that much of our model and methodology is built on the power of interpersonal relationship. It is built on community, and many of our operations around the world really rely on the group meeting as the core structure of who we are and what we do. We partner with local churches around the world, and so the physical act of gathering is changing in many countries, and I believe in a very short time is going to change in virtually all the countries where we operate. So it's problematic operationally when our core model does not allow us to have groups to meet. That means we're going to be switching as well in global operations to creatively using technology, to creatively figuring out what it looks like to love and support the entrepreneurs at this moment, because I know from personal experience that you remember the friends that are there when you're in a moment of need, and the entrepreneurs that we serve around the world, the church partners that we have, this is a moment of need, and they, Lord willing, are going to remember that Hope is an organization that walked with them through this. I wasn't expecting to get emotional, but I really do see this as an opportunity to love well. And it's not just the operations, but I believe this is a wonderful opportunity for the nonprofit community as well. You know, for years, Hope International has been on this journey to say we don't operate in isolation. We know we need each other. And we feel it right now. And I've been so grateful for the partnerships with Compassion and the Accord Network and so many great organizations that we've been sharing information. Hey, how are you responding right now? What does it look like? Sharing material, sharing travel policies, sharing things almost on a daily basis. And I am so glad that we are part of a community that is not just thinking about our organization, but realizing we're in this together and we need each other. Friendships matter, and I am so glad that we have the relational capital over years with Hope International and our partners. And then we also know that this crisis, it impacts our supporters. We know that this impacts many of you. I've had conversations with many about the direct impact on business right now and what that means for you as well. And I want to say that as you are going through this, we as a team at Hope International are doubling our commitment to prayer. We're doing it virtually, but I can tell you that if any of you have a specific prayer need, please share it with any of us. We will pray specifically for you because we want to be walking with you in the midst of this as well, knowing that these are uncertain times and the full impact we just don't know, but it continues to unfold. And in the midst of this, I also want to say thank you. Yesterday, 2 supporters in particular reached out and wanted to let us know about their gift for this year. And I can't tell you, as we also make decisions as an organization about thinking about budget implications and thinking about what we do to be wise stewards in this particular time, the way in which those 2 reached out and many of you who reached out and just be open and honest with communication, that is enormously helpful as we all walk through this together. So yesterday, we know that Governor Tom Wolf, he talked about closing in Pennsylvania all non-essential businesses. And so as part of that, we already have shut down the office. There's just a few of the tech team and myself that are here, and we're going to be leaving in a very few minutes as well. We are going to shut down our office here in Pennsylvania. But I can tell you, when he talks about this idea about non-essential businesses, we're in the business of hope. And that is an essential business, and that business, it's only going to ramp up in the days and weeks to come. We are not shutting down the ministry of hope. We are proactively asking the question of what it looks like to love well right now. And I believe that this is a wonderful opportunity for us to show that our faith, it just makes a difference in how we love and how we respond. Andy Crouch wrote a wonderful piece, and in it he says that this crisis presents an extraordinary opportunity to fortify small communities of love and care for neighbors, and that will only happen if we lead in a way that reduces fear, increases faith, and reorients all of us from self-protection to serving others. May that be what we are known for, not self-protection, but actively serving others. And for all of us, our prayer is that we would have strength for today, the decisions that need to be made, and bright hope for tomorrow. And when this passes, and it will, how are we going to be remembered? And I hope we're known as a church that has radical care for the vulnerable, radical care for those in need.